Dental caries and theories of dental caries. Dental caries is one of the most chronic, devastating disease of mankind. It has been affected mankind since yesteryears, and today it has become an epidemic. So, today we'll talk about the definition of dental caries, the various factors responsible for the initiation and the progression, the various theories on postulated for the initiation and progression of dental caries, and the classification. What are the various types of dental caries? So to start with, dental caries is an irreversible microbial disease of the calcified tissues of the teeth, which is characterized by the demineralization of the inorganic portion, whereas the destruction of the organic substances of the tooth structure, further leading to cavitation. There are certain factors which may be either primary or secondary which are responsible for the dental caries process. These may be: first is the microorganisms, second is the substrate, third is the host or the teeth structure, and fourth is the time. Now, microorganisms or the bacterial process which carries out the dental caries is one of the main originating factor for the initiation and the progression of caries. There are certain groups of bacteria called the mutant streptococci bacteria which are responsible for the caries process, under which lie Streptococcus mutans and Streptococcus sorbinus. So, as the first tooth erupts in the oral cavity, the colonization of this group of bacteria starts. Although it is present since birth in the oral cavity, like in the saliva, on the buccal and the lingual mucosal surfaces of the teeth as well as the tongue, these bacteria are innocuous at the time. But as the tooth erupts in the oral cavity, they start adhering to the tooth and causes further destruction of the tooth. Now, initially they are not of any harm. This is because of the shedding process, continuous shedding process of the mucosa, which will lead to shedding of the bacteria also. But the tooth is non-shedding, so it colonizes on the tooth, adheres to the tooth and causes a demineralization. Now, what is plaque? Plaque is a firm adherent layer. It is a film which is formed on the tooth surface. It provides a habitat for the bacteria to colonize and grow. So this plaque is also containing the bacterial acids which further demineralize and decalcify the tooth structure. There are various groups of bacteria: staphylococci, streptococci, lactobacillus, as well as actinomycosis, which is also present on the tooth surface in the plaque. Now, saliva, which is an environment for the conducting of dental caries, it possesses certain immunoglobulins, certain ions, cations, anions, which causes the buffering action. Saliva helps in lowering the acidity or the pH of the mouth, which prevents further decalcification. Now, the kerogenicity of the diet is directly proportional to the presence of the carbohydrates in the diet. More the amount of carbohydrates, more is the kerogenicity of the diet. In human diet, they mainly consist of carbohydrates that are taken, like the chapatis, the vegetables, the fruits and all contain carbohydrates in ample amount. And one of the most maximum intaken carbohydrate is sucrose. Sucrose is also considered as an arch criminal. Now, why is sucrose called an arch criminal? It is one of the most kerogenic sugar found. This is because sucrose helps in adherence of the bacteria to the tooth surface, and further bacteria metabolizes the sucrose into acids which will demineralize the tooth. Now, there are other minor factors which are also responsible for the caries process. These are the composition of the enamel, the inorganic as well as the organic component of the enamel of the tooth, the morphology of the tooth. Sometimes there are certain morphological aberrations in the tooth structure like dens and dentae, etc., or the amylogenesis or dentinogenesis imperfecta, which may lead to the increasing incidence of dental caries. Then thirdly, there is a position of the tooth. For example, if the crowding of tooth will be there, the tooth it will be more prone to the accumulation of plaque, further leading to the increased incidence of the caries. Then diet I have already explained. The presence of the sugar will be increasing the cariogenicity of the diet. The immunity of the tooth, particularly if the tooth or the host is more immune to the caries process, which will lead to less caries process in the tooth structure. Now coming over to the microbiology of the dental caries. There are certain groups of bacteria which are involved: streptococci, Streptococcus mutans and sorbinus. Then lactobacilli is the Lactobacilli acidophilus. The some possibly associated bacteria are Streptococcus myitai and Actinomycosis viscosus. Actinomycosis viscosus is responsible for the caries in root surfaces. Now, there are certain microorganisms which are responsible for dental caries process. They are Streptococci group, that includes Streptococcus mutans and Streptococcus sorbinus, whereas Lactobacillus group includes Lactobacillus acidophilus. Possibly the other bacteria which are associated with caries process are Streptococcus mitis and Actinomyces viscosus, which is also responsible for the root caries. Now coming over to the theory of the cause of dental caries. These theories can be divided into earlier theories and modern theories. The earlier theories include the toothworm theory, the humoral theory, and the parasitic theory. The toothworm theory states that there are certain worms which are present in the body which are responsible for the dental decay. These toothworms causes the destruction of the tooth structure, and they were treated in earlier years by the help of fumigation, etc. Now, humoral theory states that there are certain humors or fluids which are present in the body of a living being. That humors are phlegm, phloem, or bile. If there is an imbalance of these humors in the body, it will lead to decay of the tooth. Now, there were other theories. Parasitic theory, it was given by Leeuwenhoek. He again stated that there are certain microorganisms which are required for the progression of caries. Now, under the heading of modern caries, modern theories of dental caries come the proteolysis theory, the proteolytic chelation theory, the chemoparasitic theory or the acidogenic theory, which was given by Miller, and other theories. Now, explaining these theories further. Now, what is chemoparasitic theory? It was proposed by Miller in the year 1890. It is one of the most widely accepted and the popular theory. Now, what Miller said that dental caries are initiated by the means of acids which are produced by microorganisms. These acids are proteolytic in nature. These proteolytic acids cause the demineralization or decalcification of the inorganic component of the tooth structure. Now, as the tooth structure gets demineralized, it is weakened. Further, these acids attack on the organic component of the tooth structure and further weakens the tooth, thereby reducing its capacity to withstand the occlusal forces. The further occlusal forces will cause the wear and tear of the enamel and further the dentine. Now, he concluded from this theory that there are multiple microorganisms or multiple group of microorganisms, not a single group, which is responsible for the caries process and the degradation of the tooth. But he could not explain, that is, there are few drawbacks of this theory. One is he could not explain that why in specific species of organism there is entirely no dental caries, or why there are certain caries immune tooth surfaces like smooth surface are more immune to the caries process. And he could not also explain the phenomenon of arrested caries. There was another theory which was given by Gottlieb in the year 1947. He explained that there are certain proteolytic enzymes which are released from the bacteria which causes the destruction of the tooth structure. But first, there is destruction of the organic matrix of the enamel, which again weakens the tooth, As the organic matrix of the enamel is destroyed, the minerals, that is the calcium, the phosphorus and the magnesium and other inorganic components, they are detached from the tooth surface. That is, the bonds, carbonated bonds are broken. This leads to detachment of the minerals from the tooth surface, which will be washed away in the saliva and destructing the tooth structure and leads to cavitation. But he could not also explain the role of pH, the role of fluoride or the role of sugars or diet in the initiation of dental caries. There was another theory which is named as proteolytic chelation theory. Schwartz had postulated this theory. This was also based on the proteolytic enzymes, proteolytic breakdown of the tooth structure. But he stated that these proteolytic enzymes, they release certain chelation products. These chelation products bind with the calcium ions, forming calcium chelates, because the chelation products, they are negatively charged and the calcium and the magnesium ions are positively charged into tooth surface. They bind to each other and are further liberated, leading to the destruction of the tooth surface, the enamel and the dentine. Finally, the dental caries progression takes place and resulting in the tooth decay. Another theory is the sucrose chelation theory, which states that whenever there is an increased concentration of sugar in the diet, this will lead to the formation of calcium saccharide complexes, and these calcium complexing agents or products are released from the tooth surface, leading to the decalcification of the tooth structure. Finally, cavitation. The autoimmune theory states that the autoimmune response of the body, they act on certain cells of the tooth like odontoblasts and causing the destruction of these specific sites of the tooth, leading to the dental caries process. So this is an autoimmune mechanism. Now coming over to the current concepts of dental caries. Keyes and Jordan in the year 1960 gave the caries triad, which states there are three primary factors which are responsible for the caries process. One is the susceptible host. Second is the substrate or the carbohydrates which are present in the diet. And third is the microflora or the microorganisms which are responsible for the caries. But these three components, they interact with each other, causing the dental caries. This can be explained with the help of this pie chart which is depicted on the slides. Now, but this concept was later on modified by Newburn in the year 1982. He also stated that these factors are the primary factors which are very responsible for the initiation and the progression of the caries. But other factors are also responsible, like the environment, the saliva, the buffering capacity of the saliva, etc., which will be causing the caries process. Now first is the host. Host is a tooth surface. The bacterial colonization, the initiation of the caries will take place on the host of the tooth surface. And second is the microorganisms or the microflora. If the microflora has a cariogenic potential and it is acidogenic in nature, then only it will cause the caries. Otherwise, it will not cause dental caries. And a suitable local substrate like the increased sucrose or carbohydrate concentration in diet, then only it will lead to the caries process. Now, the plaque is the primary factor for dental caries initiation. Now, we already know what the plaque contains. The plaque contains the dead organism, dead microorganisms, live microorganisms, food particles, dead cells, as well as the food diet components like sucrose. Plaque is a house for the saliva, the microorganisms to grow. It is a habitat for the microorganisms where the microorganisms colonize on the tooth structure. So the secondary factors which are in this associated to plaque are the oral hygiene. If we maintain the oral hygiene properly, the plaque will not be there. Further, caries will not progress. Another, the oral flora, which are the microorganisms. The saliva. which is the pH of the saliva. The saliva has a neutral pH, which will neutralize the acidity of the microorganism which liberate acid. Then the composition, the mineral component of the saliva like fluoride, etc. These are the ions which prevent the dental caries to progress. Then the buffering capacity and the flow, that is the flushing activity of the saliva, which will flush away the plaque particles. Then the cariogenicity of the diet, as I have already told, the fluoride content in the blood. How does fluoride acts in preventing the dental caries? First of all, fluoride, it causes the formation of fluoroapatite crystals on the tooth surface, which make it more resistant to the caries breakdown. And secondly, this fluoride also inhibits the metabolism of the bacteria, which produces acids. This metabolic inhibition will lead to decreased incidence of the caries. Now coming to the substrate. In the substrate, we consider the type of carbohydrate which is taken. The carbohydrates are of different types. They may be monosaccharides, disaccharides, polysaccharides, but mono and disaccharides are more cariogenic, like glucose, fructose, sucrose. Sucrose will further break down into glucose and fructose, which will lead to cariogenicity. Now, oligosaccharides or polysaccharides like starch, they are less cariogenic. The chemical composition of food, if the food is more acidogenic like that of citrus fruits, apples, etc., it may cause the initiation of caries. The physical characteristics, if the food is more sticky and it contains more refined carbohydrates, it will lead to the progression of caries. The oral clearance of the food, that is, the food should be less adherent to the tooth structure so that it is flushed out easily. Then the sugar intake, the amount of sugar, the frequency of sugar intake. If the sugar is intaken more frequent number of times between the meals, it will dip down the pH of the saliva and the plaque, which will further lead to the dental caries progression. Now, how the tooth plays a role in the caries process? First, the inorganic and the organic component of the tooth, the fluoride concentration in the tooth, the carbonate and the citrate level, anions and cations in the tooth surface, the age of the tooth. If the tooth is more aged, it is more prone to the caries process because it is weakened. Then there are trace elements in the tooth, the saliva which surrounds the tooth, and the composition of the enamel. Also, the position of the tooth matters. So, because in the case of crowding, it will be less prone to cleaning. Further, it will be more prone to dental caries process. He postulated that only a single type of microorganism can be responsible for the caries process. Multiple species are not required, but all the acidogenic bacteria are also not cariogenic. There are few specific bacteria which causes the caries. Induction. Now there are different type of caries. Let us come to the classification of the caries based on the anatomical site. They can be occlusal caries like pit and fissure caries. These pit and fissures are different types U, V, I, K. So depending on these pit and fissures, if these are deep, it may lead to the caries process. These are occlusal or pit and fissure caries. And the smooth surface caries are present on the proximal surface, that is mesial or distal surfaces between the teeth. And the root surface caries are present on the root of the teeth or the cementum. And based on the progression of the caries, recurrent caries or secondary caries, these are the caries which generally occur beneath the restorations. So the arrested caries are the caries in which the caries process has stopped and any intervention is not required for such type of caries. There are certain patients who happen to be treated with radiotherapy. In those patients, radiation caries is very common. Based on the severity of the caries, there are incipient caries or the primary caries which are present on the tooth surface. These type of caries are more prevalent in primary dentation. Occult caries are the hidden caries which are hidden under the enamel, which are not directly visible to the eyes. And cavitation means cavitated caries, which have the deep, wide cavity. then based on the chronology or the time of the eruption, early childhood caries which are present in infants or toddlers, then adolescent caries which are present in the adolescents, and adult caries are present in the fully grown adult. Now there are certain type of caries which are present in the primary dentition which can be named as nursing bottle caries, rampant caries, nursing bottle syndrome, baby bottle tooth decay, and early childhood caries. The most recent terminology for this caries process is known as maternally derived Streptococcus mutans disease. Now, summarizing all the above, you can see that Streptococcus mutans is one of the most important culprit for the caries process. It is one of the most pathogenic microorganisms which causes the caries. The caries can be prevented by the means of counseling of the parents, counseling of the child, diet counseling, oral hygiene maintenance measures for by the use of Pitt and Fisher sealants and fluorides. So prevention at the initial step is the best measure for treatment of the caries. Thank you.